Private funding for research was obtained as an independent research initiative granted by Boston Scientific Corporation. The speaker attendance was funded by the institution. The artificial urinary sphincter is one of the most effective surgical treatments for severe urinary incontinence. Current knowledge comes from high-volume centers, but little is known about the performance of the surgery from community practice. This study aims to report the performance of the AMS 800 artificial urinary sphincter in a nationwide descriptive multi-center study. We had a target population of around 600 male patients who underwent artificial urinary sphincter surgery with AMS 800 between 2000 and 2020, known from the device placement databases, but given the lack of information, only 215 were included. These cases were identified in more than 17 institutions and 4 cities in Colombia. Pre, intra, and post-operative characteristics were evaluated, mainly addressing patient-reported outcome measures in the post-operative period. The primary outcome was defined as a sphincter survival and secondary outcomes as information related to complications and patient-reported outcome measures. Retrospective data collection and descriptive data analysis were performed. Kaplan and Mayer analysis was used to determine sphincter survival over time. In the results sections, we found that the mean age was 67 plus or minus 9.4 years, and the mean follow-up was 6 plus or minus 4.4 years. The etiology of urinary incontinence was prostate cancer surgery in 81% of the cases. The rest of the cases were related to benign prostatic hyperplasia or spinal cord injury. Notably, only 32% of the subjects reported prior formal pelvic floor rehabilitation. 17.3 had pharmacological management and 31.3 had no treatment before sphincter placement. A review of the sphincter was required due to the device malfunction in 5.1%, and sphincter removal was needed in 23.2% of the cases. A visual analog scale determined the subjective severity of urinary incontinence, showing a decrease of 4.5 points after sphincter implantation. 42.9% report that their incontinence after sphincter replacement did not cause any discomfort, and 99% considered the device easy to use. 99% would recommend the device to a friend or relative in the same conditions, and 92.7% referred not having pain or discomfort when using the device. The sphincter survival rate at 2 years was 76%, at 5 years was 70%, at 8 years was 60%, at 10 years was 57%, and at 14 years was approximately 17%. The percentage of mechanical sphincter failure was 2.8%. Of those subjects who still have the device in place at the last follow-up, 80.7% define their urinary condition as does not cause or cause minor discomfort. A review of the general and community practice of the placement of the artificial urinary sphincter AMS 800 was carried out, finding that most of the patients were taken into surgery with the adequate indication given for severe urinary incontinence classified through the use of PATS or prior ICIQ scale. However, poor quality of the information provided excluded a significant number of cases, and high heterogeneity was found in the antibiotic management and preoperative approach of the patient. Additionally, in the postoperative results, early complications related to retention and urinary tract infections were found. Regarding long-term complications, the most frequent complication was the erosion of the cuff in the urethra and the device's failure. However, this accounts for only 9 in 6 patients respectively. According to the Kaplan and Mayer analysis, it was found that survival rate of the sphincter is low, about 10 and 14 years of follow-up. Finally, the rate of improvement is encouraging. The quality of life also improved, and patients reported that their symptoms after surgery were not a burden. Patients defined the sphincter as an easy device to use that does not generate discomfort or pain, and they would recommend it to other patients in their same condition. As a concluding message, this study reflects the functional performance of the artificial urinary sphincter AMS 800 in a national cohort with long-term follow-up. The findings of this study allow us to determine precise numbers for a shared decision-making process regarding efficacy, complications, and the need of long-term device revision. A standardized protocol for the clinical assessment of the patient and a protocol for pelvic floor rehabilitation prior to the procedure will be promoted,